Okay. Welcome to today's webinar. Before we introduce the speaker, I want to make a few brief announcements. We know many of you are listening in from far away and can't attend our local events or programs. That is the main reason we provide this free webinar series. We host multiple webinars per month, so please visit our website to review the current schedule. The 2017 schedule has been added, so if you're not on our email list, I encourage you to visit our website and click on the Join Our Email List link that appears on the homepage. To get instant news and events from the Johnson Center, follow us on Facebook and Twitter, as we often announce grant and scholarship opportunities, research opportunities, and last-minute events and presentations there. You can find links for these on our website at www.johnson-center.org. Be sure to follow our Facebook page, and also we will be posting information on our upcoming summer camps and programs. Be sure to follow our colleagues at the Autism Research Institute as they host their own webinar initiative, and they share some great resources on their website and social media pages. Before we begin the presentation, please note that questions may be typed into your control panel throughout the presentation, and time permitting, they will be addressed during the presentation. Also, for those who have requested copies of the presentation, we do not send out the presentation slides. However, we do post recordings of all our free webinars on the Johnson Center YouTube channel. Please search for us on the YouTube channel and subscribe to get full access to all of our recorded webinars. Now please welcome our presenter, Jeanna Hill. Jeanna Hill received her BA in psychology with a minor in early childhood intervention from Texas State University. She then went on to obtain her master's degree in family and child studies on the Child Life track. She completed a Child Life practicum and Child Life internship at Christus Santa Rosa Children's Hospital in San Antonio, Texas. While there, she was placed in the hospital's outpatient clinic, as well as completed her internship rotations in the GI unit and emergency department. Jeanna is currently a certified child life specialist and is trained in child development, special education, early intervention, family systems and stress, and developmental disabilities. Jeanna has experience working with children and families in various settings, including residential facilities, educational facilities, and children's hospitals, providing emotional support to families during stressful life experiences. And here's Ms. Jeanna.
Hi everyone, thank you for joining in today. I do want to apologize in advance. I have been a little sick, so I apologize if you hear some coughing. As mentioned, my name is Jeanna and I'm our Child Life Specialist at the Johnson Center. I've been working as a Child Life Specialist here for the past 5 years, and in that time I've been able to observe many of the support measures we'll be discussing today. I'm really excited to share this information with you. We did a similar webinar a couple of years ago and discussed some of these support measures to help children with autism in the medical setting. Today, we'll be reviewing some of those support measures and expanding on how we can apply these strategies into various settings. Many children who are experiencing high stress and anxiety related to their medical experience are also having difficulty in alternative settings as well. So today we'll be talking about how these support strategies can be modified and applied into various settings, including the hospital, doctor's offices, dentist's offices, and other outpatient settings. So on our agenda for today, we'll be discussing specific strategies that can be used to prepare children for medical procedures. The purpose of this presentation is to learn about simple strategies that can help children cope through their medical experiences while reducing the stress and anxiety felt by parents, and one way to do so is to help prepare children. We'll also be reviewing specific coping strategies that can be applied during medical procedures. And we'll be spending some time reviewing these procedures and how they can be modified and how these interventions can be applied to meet the specific needs of children with autism. And we'll be discussing how we can apply these interventions in alternative settings. So when a child hears the word doctor's office, hospital, they may imagine what they've seen on television, or they may think of a cold, scary environment. Maybe they've had a previous hospital experience and now they have anxiety or stress related to going back to the doctor's office. This fear can lead to higher anxiety and stress for both the patient and the parent. For children with autism, additional factors such as sensory stimulation can contribute to a patient's anxiety regarding their visit. Maybe the rooms are too loud or the lights are too bright. So another reason children may fear going to the doctor is the fear of the unknown or the unexpected. We've had many families tell their child that, or tell us that their child didn't know they were coming in for blood work. So in an effort to not worry the child, parents may actually have missed an opportunity to explain and prepare a child for what to expect. And this could cause significant fear when the child doesn't have time to process what's happening. And fear can have lasting effects. What could have been a stressful medical encounter previously has now laid the groundwork for future medical experiences. And the original anxiety that stemmed from a traumatic medical experience may then lead to a generalized fear of all medical settings. This can make simple checkups difficult for parents and providers. So what can parents and professionals do to help children maybe see the softer side of healthcare? How can we help them see this instead? And the best way to approach this is to first prepare a child for their visit. Gather information from your healthcare provider about the procedure or the event. Ask for a detailed description of the procedure, or if you can take a tour of the facility. Some hospitals will even have a virtual tour online, or they may have pictures or images of staff members that you will meet. And this can be a great resource for families to help get an idea of the environment and what to expect. Really, the more information you have, the better. Healthcare providers can also help in preparing patients by providing the patient and family with details of the environment, including sights, sounds, and smells that they may experience. Again, the more detail, the better, as children will tend to fill in blanks with what they fear might happen. And parents, if you know your child has high anxiety in large crowds, maybe plan to make maybe you can make a plan to communicate that to your provider, and this may make the waiting time shorter for you and your family. You can also have a plan put in place to bring items such as headphones to reduce the noise. So these extra steps can be necessary, especially with our kiddos with autism or those that have difficulty with sensory stimulation. Some hospitals or clinics have procedural preparation books or videos that you can watch prior to the experience. Working as our child life specialist here at the Johnson Center, one of my main roles is to help prepare families and patients for their visit. So we've worked to create videos that walk families through our office and guide them through our playroom and through our clinic rooms. And many pediatric settings offer child life support or resources that are similar that will help families to navigate through their healthcare experience. If you are unfamiliar with those support services, you can request child life support, or you can find videos online made by child life staff members that will help prepare you for various procedures. Another great option would be to visit the facility during community events that are offered. Here at the Johnson Center, we offer many social events throughout the year, including Christmas parties, trick-or-treat, or summer camps. And these are opportunities for parents to visit our facility during a time that can be seen as non-threatening. So our children, our patients, are not coming to visit our doctor, they're not coming to complete testing, they're just coming to have fun, and they can learn to associate our environment with a positive experience. So I would encourage our listeners or viewers today to ask about events like this from your healthcare provider and see if there are any fun community opportunities to bring your family to. Preparation is key in addressing any fears or misconceptions children may have. Some of the most common misconceptions include standard procedures such as completing blood work or non-invasive tests such as getting an X-ray or a CT, also known as a CAT scan. And for our young, magical thinkers, hearing that they have to get an X-ray can be pretty intimidating or scary. Take, for example, into account how similar images of X-rays are to pictures of Halloween skeletons. For our young children, a skeleton is most often associated during Halloween representing a character that's spooky and scary. And while we know that X-rays are not painful and they do not include jumping skeletons, we may want to clarify that to our kids. Instead, we can help them to understand that an X-ray is only a picture and talk about a time when they most recently had to take a picture. Break it down for them. What did they have to do? They had to hold really still until the picture was taken. Did the picture hurt? The picture did not hurt, and it was a pretty easy, fast thing that they had to do. And this is what they can expect from an X-ray. An X-ray helps the doctors take a really cool picture. You also want to be sure that when you're explaining a procedure to a child, you're taking into consideration their developmental level of understanding. You're also taking into consideration how early you prepare a child. So younger school-age children may benefit from explanations right before the procedure so they don't have a lot of time to worry or to forget what their instructions are. Older children may want more information. How does an X-ray work? How long does it take? What happens if I move? Again, going back to alternative settings, this is something to consider when taking your child to a dentist. We often have to get images of our teeth during these appointments. So talk about what to expect and how this might be similar to an X-ray the child has done in the past. And when you're preparing your kids for procedures or for their medical experience, be sure that you're using honest, developmentally appropriate explanations to help a child understand the experience. Parents, use words that your child is familiar with, your child knows, and describe the experience in relation to how it will directly affect them. So you may feel the room is cold, the lights may be bright. You will have your iPad so you can watch a video to really help them to understand what their experience will feel like. Professionals, think about ways that you can allow a sense of control or how you can provide choices during the procedure. This is especially important for our school-age kiddos. You can say things like, you can sit by yourself or you can sit on a parent's lap. You can help offer them a color of Band-Aid or a color of wrap at the end of the procedure. Healthcare professionals, it's also really important to explain the procedure in a calm voice and talk to both the patient and the parent. If a parent is stressed, the child will likely be stressed. And some parents choose not to allow their child to observe the procedures, such as blood draws, for fear that it might scare the child. And while this may be true for some of our kids, others, it may actually increase a child's fear and anxiety. Think about how they interpret that. If mom or dad doesn't want me to see this, this must really be scary. So instead, offer the choice to look away or to look. If they choose to look away, be prepared to bring an item to distract, such as a video or a book. Again, preparation is key. You want to explain what is happening during the procedure. Professionals, talk to both the patient and parents, helping them to understand each step. For our kiddos, explain in simple, direct language. For example, when cleaning with an alcohol swab, be sure and explain it may feel wet, it may smell funny, but it should not hurt. Again, there may be a misconception that this step will sting. Parents, your voice is the most important to a child, so be prepared to take an active role in the experience. Help the provider by reinforcing the steps. Engage with the child and help to redirect their attention. Counting and singing has been highly effective methods of distraction. And many times the best distraction for a child is just listening to a parent's calm, soothing voice. It's what you say and how you say it. So language can be pretty harsh or scary depending on the words that you choose. So think about ways to communicate using non-threatening words. For example, instead of saying, "You are going to the hospital" or "You're going to the doctor's office tomorrow," you can make it more personal and say, "Tomorrow we're going to see your friend Anna," and Anna may be a nurse. It's never productive to lie to a child or to give them a sense of falsehood. This typically increases a child's fear once they realize they've been lied to. In some cases, parents or clinicians may feel like the less the child knows, the better, which may be true depending on the patient, but explaining the event or talking about the experience may be less productive if the child is already overly anxious or fearful. So really assess a child's level of anxiety and determine the most appropriate method of preparation and when you decide to prepare a child for a procedure. And you want to be able to provide learning opportunities. The best thing that we can do is allow children to freely and safely explore their environment and the medical equipment items used in their procedure. Many items can appear threatening, but when a child's able to touch or play with that item, it becomes familiar and fun. So offer patients opportunities to touch items such as the tourniquet. You can refer to it as a large rubber band and allow the patient to pull the sides. And depending on the developmental age of the child, you can offer to have the patient apply the tourniquet to a parent's arm. This allows a sense of control over the situation. If a caregiver also plays along, wearing the tourniquet, this can provide a positive model. And it's easier to follow the example of a caregiver than follow verbal instructions of a stranger. These easy steps can help in reducing the fear of the medical items. This strategy can also be done in outpatient settings. So for items that can seem threatening, it may be better to allow the child to touch the instrument first or allow the parent to hold the tool. Practice on a parent first and then try on the patient. Another way you can prepare a child for their procedure is through play. It's best to let a child lead so that you can get a general sense of what their understanding is and address any fears and misconceptions. Medical play allows a child to freely explore materials that they will likely encounter during their medical visit. Parents can provide this opportunity before their appointment or after, depending on the level of anxiety the child has. You can pretend that a doll is completing the same test and a child can review the procedure with the test, and that allows you to observe how the child goes through the process. So for example, if a child is going to the eye doctor, will she pretend that the doll is having a shot in the eye? If she does, this can give us some insight to help clarify those steps and be able to observe what that fear or what that underlying stress is. Therapeutic games and activities can help children become familiar with medical supplies in a non-threatening way and can help patients become desensitized to particular items that they find fearful. Some specific ones include needles or syringes, which can be threatening for many children. But when you fill a syringe with water or paint, all of a sudden it becomes a fun tool. Syringe painting is a great activity for providers to help children become familiar with the item and use it in a creative way. And it becomes less fearful and maybe even will help them in taking some medication if they're more familiar with the syringe. For those patients that are fearful of needles, it may be helpful to talk about the use of a needle as a helper. So you can use a pillowcase as an example to help a child understand. If you're trying to sew through a pillowcase, Would a straw be helpful? Most likely not. Most likely the straw would bend. So you need a helper instead. So the needle goes into a catheter, which is a tiny straw that helps the doctor or nurse find the best spot. So once they have found the best spot, the helper comes out and the straw stays in. This is what helps us to get medicine into our bodies, and that helps us makes us feel better. So a straw is something that children may be more familiar with versus saying something like a catheter. And you can talk about how a straw bends and how small it is. So all of a sudden, that's less threatening than talking about a needle, how sharp it is. Some kids may feel like they can't move their arm because the needle is still inside of them. So this is extremely helpful if you're using something like a small catheter during a blood draw or during an IV to help them understand that the needle is coming out and just a small tiny straw is staying in. You may also want to have a few medical play sessions after a child has had a procedure so that you can help them cope with the experience. So needle play is another form of medical play, usually directed by a child life staff member or somebody trained in it, that helps a child become desensitized to that to a needle, using it through play. Again, providing a safe and non-threatening way of exploring the items can help them to process their emotions. Think about other creative ways that you can include medical supplies in familiar ways, such as hospital bingo. Hospital bingo allows patients to become familiar talking about items such as needles, Band-Aids, the thermometer, in a way that's fun. They are actively seeking these items in hopes of winning the game. Other simple ways of helping children become familiar with items include creating coloring books. So you can find non-threatening images of a doctor's office or medical supplies and include them in coloring pages that children can then play with while they wait. And this helps them to identify those items later on. I want to provide a sample scenario of a medical play session. So in this scenario, Heather is a 3-year-old with autism. She has significant anxiety during blood draws. To address the concerns, a nurse and child life specialist provided medical play prior to the blood draw. Heather is introduced to a tourniquet and allowed to play with it freely. She allows the tourniquet to wrap around the father's arm. Then she wraps the tourniquet around a nurse's arm. And then finally, the nurse is able to wrap the tourniquet around her arm. Heather becomes anxious as she sees a medical wrap. A child life specialist tears a piece of the wrap and puts it around a stuffed toy. Heather uses a piece of medical wrap and puts it around the toy's leg. Heather then allows the nurse to put the wrap around her arm. Here is a sample scenario of a medical play session that you can do at home. Michael is a 6-year-old male with autism. Mom has noticed that with the increased medical visits, he's becoming increasingly aware and anxious when he goes to the doctor. She uses a medical play kit to help Michael act out his experiences. As Michael becomes more familiar with the items, such as the alcohol wipes, Band-Aids, and tourniquet, he is less anxious when he sees these items during his next visit. For those of you that are working with a behavioral provider, an ABA provider, I would also encourage you to talk to your therapist or your other team members about how you can do these sessions in alternative settings and how they can incorporate that into their therapy sessions. So we've talked a lot about ways that you can prepare a child for their medical visit through play. For those patients with autism that may have difficulty with expressive or receptive language, a procedural prep book or a video might not be as effective in preparing for their experience. Additionally, hospital tours that we discussed early on may be difficult to schedule for those patients that have challenges with routines and transitions. So for those unique needs of those patients, creating a social story can help. And many people use social stories to help explain situations that may be confusing, may be scary, or may be new. The social story can help your child to understand the experience, which may decrease their stress and anxiety regarding that experience or procedure. You can find our social story online if you'd like an example. Here is just a quick excerpt from the social story of Visit to the Johnson Center, which outlines each of the rooms that the child will visit. It has information on the people that they will meet. And this was a really great way for us to show what the environment looks like so that our families, especially those that are traveling, that are in the area, that come to our community events, they know exactly what to expect. So in addition to providing our families with this resource prior to their visit, we've created a book that families can read in our waiting room. And we've provided images of the typical places our patients and families will visit during their procedure. Our wonderful child life intern looked at our social story that we had online and was able just to make a hard copy book, and we have that for our families to come in and look through the images. Think about the appeal when you're creating your space. So when you're looking at creating these prep books, it allows healthcare professionals to really take an inventory of the environment. And so you want to create a space that is realistic in providing procedural support, but you also want patients to leave with a lasting impression of comfort and fun. So make sure that your rooms are stocked with age-appropriate toys and games. And if you're seeing an older child, maybe it might be helpful to redirect them to a teen room or a space that doesn't feel so young. In addition to creating a social story that outlines the environment, we created a social story that outlines each experience or procedure, including something as simple as getting a height and weight completed. So in your social story or prep books, you may want to add those simple tasks that patients will be asked to do, such as get their blood pressure taken. While this may seem non-invasive, for a child with high fear and anxiety, it can be a pretty difficult task. So by preparing a child first and having them see an example of another child completing the task, this may make it easier for them. Also, seeing a picture of a doctor or a nurse may be helpful, especially if it's somebody that they're going to be meeting that day. Which takes us to our next part of the social story. It's important for our kiddos with autism that may have some challenges with transitioning to have a transitional person. So at the Johnson Center, our child life specialist, myself, can help those families move from one appointment to the next and help them to navigate through their day. If you're working with somebody like a social worker or a nurse, you might be able to ask them if they will be able to be a transitional person, and so that helps you to form that rapport and help you along with your visit. The use of a visual schedule can also help support patients with autism, especially a routine and preparing these patients for changes in their schedule. This can help children with autism succeed in a new environment. So by providing them with tools to understand their experience in small steps and stages, we're allowing them to anticipate transitions and feel secure with the schedule. And you can review the schedule at home before the procedure and again while you're waiting for your appointment. You can also create your own visual schedule by using a photograph or a picture and creating a first-then board to illustrate the procedure. So this is kind of a good example of what you can create online. We use this as a model to create our own visual schedule, So when families come in, they go through each of these steps. And what we've done, our wonderful child life intern again was able to create this, and using Velcro, we're able to change some of these appointments. So if we know a family's coming in, but they're not necessarily going to get a blood draw that day, that step can be taken out and the other steps moved up. After a child completes each step, they're able to Velcro on their check mark that they've completed the task. And this is just a simple pocket folder. In the back of this is a bag that the check marks stay in, so something fairly easy to create. This schedule helps our patients through their appointment, and they're able to, again, place that check mark after each task is completed. And this has been a really wonderful tool that's helped our families and our patients through each transition. It's also really easy to create. So if you know that your families are going through specific appointments that day, it's something that you might be able to find a template online and then create their own individualized schedule. Parents, this is also something, I'm not sure if you're already using a visual schedule, to think about if you're working with a behavioral provider that they can create for their doctor's visit, their dentist's visit, and things like that. It's also really tangible, so our patients are able to take them throughout their visit. So when our families come in, our families are welcomed with their own kind of schedule of what to expect, but this is particularly for the patients. This is just for the child to go through, and so it really helps them to kind of experience their appointment in stages and break down into simple tasks. Another useful support strategy that can be used for children with autism include the use of a power card. And a power card is a simple story using the child's preferred interest that helps summarize simple steps that a child needs to complete. You can create an easy template, and once you know what the child's preferred interest is, add it to your story. For example, in this scenario, we have Curious George. However, if our families expressed to us in advance that the patient was really into, let's say, Thomas the Train or Dora, then we would find an image of that and include that into the power card and easily change up the template. These power cards are really helpful with 3 or 4 step commands, such as taking blood pressure or having a blood draw, maybe doing a height and weight. And you can easily create these power cards using index cards. And then you have individual power cards that you can take with you to each appointment. You can use the power cards when you're going to the eye doctor or when, again, you're going to a dentist. The templates are fairly easy to create and allow you to modify your appointments while still being able to use the same character. So going back to that preparation, if you know what procedure you're having and your healthcare provider has talked to you about the steps, then you can use a power card to create those steps in a way that a child is familiar with and understands. Essentially, you can use a child's fixed interest as a way to motivate their behavior. And then again, if you're working with a behavioral therapist or a provider, talk to them about how they can use power cards to help as well. So we've talked a lot about how to prepare for your appointments. Now we'll be discussing some specific coping strategies that can be used during medical procedures. If you're a parent and know your child responds to specific support measures, be sure to communicate that to your provider. That's really helpful in helping us create an environment that's really catered to the needs of the patient. Different distraction items that have been helpful for our kiddos here include the use of bubbles. This is a really easy way to not only distract patients, but actively get them involved in deep breathing, which can help slow a patient's heart rate, making finding a vein easier for our nurses. Pinwheels are another great way and an easy distraction to help with deep breathing. And this also provides an opportunity for counting, which has been extremely successful with our kiddos here. I Spy books are a great resource for those particular patients that we discussed earlier that may have a fear of watching the procedure. So you can actually use this book as a barricade. This provides a less threatening alternative to blocking or covering a child's eyes. This also provides opportunities for parents to engage with their child. Again, this is highly effective in distraction. Squeeze balls are a great tool to get a patient's blood flowing. So using a squeeze ball or a stress ball or any kind of smooth jelly-like toy, patients can open and close their hands, counting how many times that they do so. And these squeeze balls are a great way of getting a child to hold their hands still. Less movement is seen if a child has something to hold on to. Parents, encourage your child to bring their favorite toy or object into the procedure room. This transitional object can help your child feel a sense of comfort and decrease their anxiety. Sensory items, especially toys that vibrate, can help your younger children cope through the experience. Prior to a blood draw, you can put a toy that vibrates on the location so that the child becomes acclimated to the feel. Encourage your child to participate in the activity during the procedure. So they can read a book, watch a movie or a video, maybe sing a song together. It's important to take into account what measures have worked for your child, as every child is different. So learning what works best for your child is key, and then expressing those support measures to your provider is also key. Remember, any comfort measure implemented today can benefit the child tomorrow. So we want to make sure that we're laying a positive medical visit that lays a strong foundation for future medical experiences. We discussed the benefits of bubbles earlier. Here's another example of how you can use bubbles as a support measure. So if possible, fill the procedure or the clinic room with bubbles. When patients walk into the room, they're less likely to feel anxious about the experience if they're distracted by a room full of bubbles. They're also less likely to associate the room with a negative experience if they remember it as something positive like the bubble room. You can also allow the patient to blow bubbles during the blood draw. Practice blowing small or large bubbles and count how many bubbles the child can blow. I'd like to take a brief opportunity here to talk about siblings. Oftentimes, siblings come with our patients to their appointments, or they're with them during outpatient medical procedures such as blood draws. And blowing bubbles is something that can be useful for a distraction for a sibling. Ask siblings to help blow the bubbles, which helps to redirect the family's attention. This is really a family experience, and we're never just treating an individual, we always treat the entire family, so help them to get involved. This is a great picture for me. It serves as a conversation starter. What do you see? What images can you find? If you're unable to access distraction items, think about creative ways of starting conversation. In our procedure room, we have a large I Spy decal on our wall. This is a simple way to start a conversation. Ask patients to find an item. Sometimes it's even more effective if you ask parents to find an item. This allows for parents to actively be part of the experience. The opposite is also true for some families. So some children may have higher anxiety with loud noises. In an attempt to distract a child, sometimes too many voices are present. Healthcare professionals try to engage caregivers and allow them to lead the conversation. Remember, a child will most likely respond to a parent's voice. If you're noticing that the parent is also stressed, lead them to conversation that's less dialect and more reinforcement. Praise a child for holding still, using language that a parent can follow and add to. Instead of saying, "Great job," try saying, "Great job holding still," so a parent knows what to continue praising. The use of the iPad and phone have been extremely effective with our patients and families. For some of our patients with autism, the use of the iPad has helped in not only providing distraction, but has also been a means for communication. Family members have frequently used family videos and pictures to help, and this is something that you can access prior to the procedure so you know if you will have the space or if you will be able to use your iPad. Going back to preferred interests for children with autism, this is another opportunity to have specific videos of their interest ready to engage with the child. Not all videos work for every child, so if you're using this as a means of support, ask the family prior to the procedure, again, preparation, if there is a specific game, an app, or a video that will be helpful. There are some games and apps now that are used to help support children with autism through medical procedures. Some apps I've found to be most helpful include the use of music or recordings. And these are helpful in that they don't require hands to be able to navigate through the program or the app. So if you're doing a blood draw and your patient has limited mobility, try using an app that will instead mimic their voice or have dancing characters and instead don't require the use of touch. During the procedure, you can also help your child visualize a more pleasant experience using guided imagery. You can talk to the patient about different sounds, smells, or places that will help distract your child from the medical procedure. When your child is tense or anxious, their veins can become smaller and harder to find. So long, deep breaths can help a patient to relax. And you can ask your child to imagine blowing up a balloon or counting the breaths that they take. In this specific image, they're imagining that their breath is blue, and visualizing this can help distract a patient from their experience. You can help your child focus on relaxing different parts of their body. It's best to try and practice relaxation techniques before the medical appointment, and you can describe relaxation in terms that a child will understand. So try saying something like stretch like a cat. It's best to use these strategies when your child is calm instead of trying to use these strategies after they're already visibly upset. Comfort positioning is one of the most effective support measures that I've seen. This provides an opportunity to address a specific fear of being forced or held down. And for many children, this fear is more significant than pain or fear of the needle or procedure. It's the basic fight or flight instinct, and our kiddos may not understand the procedure or why they have to stay still, which is extremely terrifying. And again, we're setting the groundwork for future medical experiences. So instead, let's think about a way that we can create positive experiences. And one way to do that is to highlight comfort measures. There are specific positions for comfort that can be used for different procedures. What you notice in this picture is that a child is sitting on a caregiver's lap facing away from the procedure. So this can be helpful if you know that your child or if you know that the patient has high anxiety looking at the procedure. But again, you don't want to force their face away, so you want to do it in a way that's non-threatening. This tight hug from a parent, it absolutely does that. It provides that restrictive ability to see the procedure while also being comforting. Bubbles are also being used as distraction, and the caregiver is providing that comforting hug for stability. What you'll also notice is that the child's legs are across the caregiver's body, which provides protection against kicking. This same position can be used facing the opposite direction, and we'll give you an example of that in a little bit. But what you can do is have a child sit in a caregiver's lap facing the opposite way, have caregivers cross their legs over the child to reduce kicking, and have a caregiver hug the child from behind, explaining to the patient that they are receiving a tight hug from their parent. This provides upper and lower stability of the patient without any restriction. Here is another example of a comfort measure, comfort positioning, this time being used on a doll for an example. Again, this is an important step to show children what to expect. In this scenario, the arm does not have stability, so you may want to use a table or a board for safety. But this picture kind of gives us a reference to help teach other healthcare professionals and other team members about comfort positioning and ways that we can do so. The hold is really important here. Look at the upper and lower body support. I love that the caregiver has their mouth near the ear, and this is important when providing positive praise or feedback from the caregiver. Going back to what we mentioned before, our caregiver's voice is the most important voice in that experience. And what I've seen is that it helps when parents whisper, sing, or even make a shushing sound to calm your child down. And this hold provides the perfect placement for that verbal feedback from the parent. Here are some different images of the comfort positions that we discussed. So in the image of the younger child that's facing away, that's kind of what we talked about before. So back to chest bear hug works well for IVs and blood draws. You're providing that upper lower body support support. It does work with our younger kids. It may not be necessary to cross your legs over, such as the first image where you see that she is crossing her leg over the child, and that does help with lower body support. This also really helps for patients that have a hard time with banging their heads or using their heads against the caregiver. So we want to make sure that we're providing a safe environment. And if you're providing that upper stability, then that's going to reduce that action. The back to chest bear hug works best in our work environment. But you really have to think through what's working for your environment, or as a parent, what's worked for you in the past. And that's what's happened in our case. We've had a lot of our families come in and tell us that they've had experiences where their child has not been able to complete a procedure. And so doing things like comfort positioning is new and novel to them, and they're able to take away that strategy and go with them to their next experience and talk to their provider about using a different approach. So it's really helpful once you do find something that works, that you use it again, or you talk to your different providers, different therapists. Also the same for healthcare professionals. If you've seen something that a parent brings in that's new that you haven't tried and it works for that patient, talk to another family member and say, this has worked for some families, would you like to try this? And that may be a way for you to continue your education on what works for some families. The most important part is just, again, providing that stable, safe environment and helping parents to become active members in that experience. It's helpful to bridge that bond and to use that to provide a comforting experience. I want to talk briefly about pain management. So research does show that stress leads to increased tension, which contributes to higher level of pain. And if you feel like your child would benefit from pain management support, it's recommended to consult with your physician prior to your procedure and make a plan in advance. Pain management can be addressed through topical creams or sprays. And parents, it's important to communicate your concerns of pain management to your provider, as topical sprays or creams may need to be prescribed, or they may need to be used in advance of the procedure. They may take some time to numb the area, which could affect the timing of your procedure. Other pain management support strategies include the use of items such as the Buzzy, which is seen here in this image. It's a vibrating palm-sized device with removable ice wings, and together the ice and the vibration block sharp sensations to the site. I have had limited experience working with such devices, but I do know that there is growing research out there looking into these products or similar products. I would be interested if healthcare professionals or parents listening in today have tried any other type of supports and if those have been effective. Again, it just would be really helpful if you have found something that worked to communicate that to parents and providers. Communication here is key. If you're a parent that's used this device, let your practitioner know and see if it's something that they offer or something that you can bring in. This is a really, really important part of the entire process, is the power of praise and how important it is to continue providing that praise during the procedure and after the fact. We really want to validate our patients' concerns and their fears, and one way to do that is to praise them for doing things during the procedure that they can control, such as holding still. So when possible, it's good to provide choices to increase a patient's sense of control. Ask the patient if they'd like to pick out which coping strategy they would like to use. What that looks like is asking them if they'd like to, again, sit on a parent's lap or if they want to sit independently, if they'd like to use an iPad or if they want to watch a video. Help them to kind of navigate through what's going to support them. Verbal praise can be extremely reinforcing, and you can also have something like a certificate or a gold star ready to give the patient after they're done with their blood draw. If you're using something like a visual schedule, at the very end you can include kind of a template that has a gold star that they can just check that mark off. A great idea would be to have a nurse or a child life specialist sign the certificate beforehand and present it to the patient when they're done. And depending on the child's developmental age, providing choices can be significantly it can significantly impact their ability to cope with the experience. From a developmental standpoint, we know that providing choices helps to create opportunities for children to gain control over the experience and their bodies. And this can be really helpful for our older kiddos too, if we're thinking about our younger children or our teenagers, helping them to have some choices, helping them to have a role in their experience. We had done a previous webinar on patient and family-centered care, so I'll talk briefly about this today, but it really is an important piece in all of this. Preparing for an appointment, you do need to talk to your practitioner about what to expect. Providing support measures, again, practitioners help reinforce parents' role in this, and all of that goes back to patient and family-centered care. Remember to consult with your clinician regarding what support services work and what have not worked in the past. You can review previous medical history and create an individual plan for the day of the procedure that really addresses the specific needs of the patient. Some common questions to help kind of guide you in creating that plan can be asking if the child has ever had this procedure before. Ask how the child typically copes through procedures such as blood draws or IVs. Ask if there have been any specific support techniques that could help. Healthcare practitioners, you can ask if there are specific games, shows, songs, rhymes that the patient has or is interested in. Practitioners, you can also ask if there are specific stimuli that the patient has challenges with, so you know how to set up your environment. You can ask what the child's level of understanding of the experience will be, and that kind of goes back to your medical play session. What was your assessment in that process? You can talk about how you are planning to discuss the procedure prior. And healthcare providers, you can ask if parents would like assistance in this. And this kind of goes back to our families that didn't want to scare or worry the child, so didn't tell the child they were coming in for a procedure, and then all of a sudden the child has heightened anxiety or fear. So if parents, you're having trouble communicating that information, if you don't know exactly what language to use, what is considered harsh or not threatening language, ask your provider. Maybe call somebody that works in that environment. In this particular case, I welcome our families to contact me if they know that they're coming in for blood draws, so that we can create an individualized plan and talk about the language to use to prepare a child for that appointment. You can ask if the child has a transitional object that they're bringing from home. You can talk about how to best prepare and support your child by looking at offering rewards or incentives. And this helps providers, parents, if you know that you're bringing in a reward, if you know that you are bringing in some type of incentive, if you communicate that beforehand, then your clinical team can help to reinforce that during the blood draw. Your nurse may suggest something like, "You're holding still. I'm so excited for you to get whatever the reward is." And so all of a sudden the patient has kind of that reinforcement from all areas. Connecting with your healthcare team. Help your child see medical staff as helpers. And this goes back to that transitional person that we talked about before. If you're not working with a child life specialist, use your nurses, use your social workers, your medical team. They're there to help you, parents. So really communicate that to them. These individuals can work with the provider and parent to create coping strategies that work for the patients. And parents know what coping strategies work best for their child and can communicate that to this transitional person that can help create that experience. Professionals can also use strategies that have worked with previous patients, and in partnering together, there's greater opportunities for successful intervention. So we really want to set our patients up for success. And if our medical staff members are aware of the patient's unique needs, then we can set up an environment that supports those needs. So parents, it's really helpful to communicate that to your provider. Their experience will be so different in terms of a child's response if we provide a nurturing environment, if we're providing these coping strategies that specifically work with each patient. You can engage the child in ways that are playful and positive, going back to that syringe play, so using medical equipment in ways that they're familiar with, that is non-threatening. And again, just get a good assessment of the anxiety level, because this really helps in understanding when it's appropriate to prepare a child or what support measures to put in place. If you're looking at trying to do a relaxation measure, but a child's highly anxious, visibly upset, it might not be as effective as it would have been if it would have been done prior. So just get a good assessment of the child's level of understanding of the experience, the level of stress or anxiety, and go through any previous medical experiences. That way, the more information you have, the better you can plan for the experience. And remember, this is an experience. It's not a protocol. It's not one strategy works for every child. So you really have to think of what particularly will work for this family and for this patient. This is our reference. If you are interested in more information, I would encourage you to check out our website. We do have a handout for our families that kind of summarizes the information that we've discussed today. It talks about creating a visual schedule, using a social story, positioning for comfort, and different methods of distraction. For those of you that are interested in getting a certificate of attendance, you will be sent some questions and a link that you can follow after the webinar. You'll take a short quiz and then you can download your certificate. Thank you for attending. If you do have any questions, I would be happy to take those at this time. I think we have a couple of minutes left. So one question that I had is, can some of these strategies work with siblings? Yes, absolutely yes. I joke that some of these strategies can work with adults. It is helpful to use support measures for each child. So it goes back to, it may work for one sibling, it may not work for another, but comfort measures can be used in any medical procedure, any healthcare environment for any child. You really just have to think through what would work best for that particular patient. Do all medical settings offer this type of support? Many pediatric settings will provide some type of comfort measure, some type of preparation. It really just depends on how active parents are in preparing for that. And so if an environment is set up to provide comfort measures, but doesn't necessarily meet the needs of those specific patients, then it may not be as effective. So what's really important is not necessarily if all environments offer it, but if families are prepared. That way, if those environments don't offer it, the parents still have a plan of action, or they can communicate, this is what has worked in a different environment. Would you be open for me to bring in an iPad to use as distraction? Would you be open for me to come in and sit with my child because I know that they have anxiety during procedures? So it kind of goes back to really communicating. Another question, are there specific strategies that work better for teenagers? I think that this is a great question. You do want to set teenagers up for independence. That is really important for them. And so if you have a teenager, providing those choices, allowing them to lead and to navigate through their own coping strategies can be helpful. A lot of these support measures can be adapted for our teenagers, so thinking through distraction items, you may not want to use bubbles, but maybe instead you use an iPad as a reinforcer. If you're looking at deep breathing techniques, what's helped in the past is explaining it in ways that they understand. A lot of our teenagers want more information. Why exactly do they have to hold still? What is the procedure? Why is their blood being taken? What is this procedure about? What are the tests run? How long is the procedure? Those details that you might not feel the need to explain to a younger child, it may be helpful to ask of a teenager if they want more information, if they have any other questions. So when you're preparing a patient and a family, direct the questions to the teenagers, asking if they'd like more information. And that can kind of give you a better sense of how to prepare them or what to expect from that experience. If you have any other questions, I am happy to review those. We are out of time. Thank you again for attending.